Leg pain is a common problem and it can range from mild to severe pain depending on the case. One of the causes could be varicose veins. In today's Eye on Health, Dr. Jeffrey Miller joins us in studio to talk about that condition, what it is, and how you can treat it. Thank you for being here with
Hey,
us.
thanks for having me.
So let's start with the basics. What are varicose veins?
So varicose veins are just those big, ropey, bulging veins that you see in your legs. Um, the thing that people don't seem to or don't often understand is that varicose veins are actually part of a medical condition. In fact, the way I look at varicose veins, they're simply a symptom. They're a symptom of this disease called venous reflux disease, which the severe component is called chronic venous insufficiency. So the symptoms in chronic venous insufficiency or venous reflux, pain, leg pain, swelling, aching, throbbing, heaviness, fatigue, night cramps. An important thing to understand is that left untreated, this condition can lead to skin changes where the skin becomes brown and leathery, and then can actually even develop a venous leg ulcer.
Okay, Dr. Miller, I know a lot of people obviously don't like the way it looks, so that could cause some people to think that this is a strictly cosmetic situation.
Oh, we hear it every day. I mean, patients come to us, they've got varicose veins. They were told by several doctors, family, friends, oh, don't worry about it. They're just cosmetic. Here, have a pair of compression stockings. You're fine. You don't have to worry about them. But like I said, it's part of a medical condition, and leaving it untreated can lead to some pretty disastrous consequences.
Is this one of those things that can eventually go away on its own, or do you need to make sure you're going to see someone like you?
Yeah, it's not going to go away. One of the things that's also important to keep in mind, varicose veins, yes, they're a symptom of this thing called venous reflux disease, but people can have tremendous symptoms without even having any visible varicose veins. In fact, one thing that a lot of people don't know is that restless leg syndrome, which is quite debilitating, can be caused by venous reflux disease. And I mean, because that's a treatable condition, I always tell patients and referring doctors that before starting a course of medication, better off coming in for a vein evaluation, seeing if there is this venous reflux, and then we can treat it. And when we see patients that have both venous reflux disease and restless leg syndrome, you know, we can pretty much tell them that 70 to 80% of the time they're basically going to be cured, or at the very least, maybe they can stop taking the medications that they were taking or cut down on the medication dose.
Yeah, and I'd imagine this has a big impact on quality of life. In terms of treatment, what does that look like?
So before I get to treatment, you mentioned quality of life, and it's amazing the effect on quality of life that venous disease has. Patients that just have varicose veins alone have reported quality of life scores that are actually similar to people that have had prior heart attack, prior stroke, prior hip fracture. And if that's not bad, it's even worse for those that have developed, you know, they didn't get treated and they went on to have a venous leg ulcer. For those patients, their quality of life score is similar to heart failure or chronic obstructive pulmonary disease. So it's very significant effect on quality of life. In terms of treatment, I think another thing that people, you know, they're scared about coming in for varicose vein treatment, and that's because years ago, the only way to treat them was the stripping procedure, you know, big surgical procedure. Today's procedures are all in office. They're done 10, 15 minutes. You're up and walking immediately. There's absolutely no downtime. In fact, we tell our patients, hey, we want you to get up and walking. Go ahead, go to the golf course, go do whatever you want to do. So
in 15 minutes, you can change your life.
that's right.
All right, well, definitely seems like something worth looking into if that's something you're dealing with. Dr. Miller, thank you for joining us today, and we are definitely hoping that this helps a lot of people.
Thanks, Terrence.